Prognosis is the term used by doctors to describe the likely outcome of a disease, how long a diagnosed patient is expected to live, and the quality of life expected during that time. Diffuse malignant mesothelioma is an extremely aggressive disease, and the prognosis is very poor, both for pleural mesothelioma and for peritoneal, abdominal mesothelioma. Median survival time of 6 to 18 months after diagnosis is reported. Mesothelioma is classified into three types, based on the type of tissue involved. Epithelial is 50% of the cases, sarcomatoid 15% of the cases, and mixed type 35% of the cases. Epithelial mesothelioma has a better survival rate than the sarcomatoid or mixed types. Mesothelioma is also classified based on site of original involvement. The pleural or lung type is most common. Approximately 80% of cases are pleural in origin. Peritoneal or abdominal mesothelioma is much more rare. The prognosis for many cancers depends on how early the disease is diagnosed and treatment is begun. One of the main problems in diagnosing mesothelioma is that the first symptoms can be very vague. Patients may at first visit their doctors with symptoms of shortness of breath or chest pain. These symptoms can be present with a large number of other conditions, and by the time other diseases and conditions are ruled out, the mesothelioma may have advanced quite far, since it develops very rapidly. Sometimes mesothelioma develops without symptoms at first, and the first sign may be a pleural effusion or fluid around the lungs that is noticed incidentally on a chest X-ray done for other reasons. The mesothelioma gets a jump start before it is ever diagnosed, making the prognosis all the more severe. Following a diagnosis of pleural mesothelioma, chest pain and shortness of breath will inevitably become worse, sometimes followed by weight loss, night sweats, anorexia. The tumor gradually obliterates the pleural space and replaces any pleural fluid. The lung becomes encased and is not free to move. The lung can be completely covered in a thick rind of tumor of 5 centimeters or more. Operating to remove this degree of tumor encasement may be of very high risk to the patient or impossible. Deoxygenated blood is shunted through the lung, which leads to fatigue and lower oxygen levels that may not be improved by supplemental oxygen. There may be invasion of the chest wall in nearby structures by tumor mass, which can cause increasing pain and other abnormalities such as difficulty of swallowing, compression of the superior vena cava, vocal cord, or diaphragm paralysis. Metastasis can occur to the other lung, the brain, or other sites, though this is fairly uncommon. A much more common problem is extension into the abdominal cavity. This can be particularly a problem for patients who have had a good response to early aggressive therapy for pleural disease. With the increased survival time comes increased chance of spread to the abdominal cavity. Death usually occurs from infection or respiratory failure rather than as a direct result of metastatic disease. Extension into the abdomen may cause death by bowel obstruction. Invasion of heart or pericardium may cause death from arrhythmia, heart failure, or stroke. Diffuse malignant peritoneal mesothelioma, or DMPM, the more rare type that begins in the abdomen, has overall survival rates averaging 1 year. Most of these are epithelioid types. There are reports of a more indolent type of DMPM, which progresses slowly and can have significantly longer survival rates, measured in years rather than months. A major predictor of survival rate in DMPM is the depth of invasion of the bowel wall, with cases of only superficial invasion having a longer survival rate. Surgical resection of affected bowel in these cases may improve life expectancy. Doctors look at a set of indicators when determining prognosis for any disease condition. In cases of mesothelioma, There are several known factors that are associated with better prognosis or worse prognosis. Indicators of a better prognosis and thus longer life expectancy and higher quality of life include earlier stage epithelial type of mesothelioma, age under 65 years at diagnosis, absence of chest pain, good performance status, which is a measurement of cancer patient well-being based on factors such as ability to work, care for himself, etc., and presence of symptoms for more than 6 months before diagnosis. This last factor may indicate a more indolent or less aggressive form of mesothelioma. Indicators of a poor prognosis include higher stage presence of high platelet counts in the blood or thrombocytosis, elevated white blood cell count, fever of no known origin, sarcomatoid or mixed type of mesothelioma, age 65 or older at diagnosis, male, and poor performance status. Most often, treatment for mesothelioma is palliative, meaning it is based on easing the symptoms, as there is currently no cure. Radiation therapy can help with reducing the spread of tumor tissue or metastasis. Ongoing clinical trials use a combination of radiation, chemotherapy, and surgery, but no combination has clearly been shown to increase survival rates. However, experimental treatments such as gene therapy and immunotherapy offer hope for longer survival. Emerging therapies follow a multimodality approach, attacking the disease with surgery, chemotherapy, and radiation therapy, and there are trends suggesting greater survival rates. Aggressive surgery may involve removal of pleura, lung, diaphragm, and pericardium. This treatment aims to remove as much tumor tissue as possible while leaving normal lung tissue intact. There are some preliminary statistics that suggest that combining such aggressive surgery with radiation and chemotherapy for a certain subset of younger, healthier patients may greatly improve life expectancy. Sometimes it can be helpful to look at specific numbers rather than large-scale statistical studies. At the Dana-Farber Institute in Boston, doctors followed case histories of 120 patients with pleural mesothelioma from 1980 to 1995. All these patients were treated with surgery and a combination of chemotherapy and radiation therapy. Some received immunotherapy. Of patients with sarcomatoid or mixed type mesothelioma, 20% were alive 2 years later. All had died within 5 years. Patients with epithelioid type had a much better outlook. Those with no involvement of lymph nodes showed a 74% survival rate after 2 years, and 39% survived after 5 years. Newer therapies will probably push these survival numbers higher as better combinations of treatments are proved in clinical trials. Though very rare, long-term survivors of mesothelioma do exist, of greater than 10 years post-diagnosis. Researchers speculate that survival rates in these cases may have more to do with individual differences among patients than the types of therapy they receive. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.